So I'm Sarah, and I'm a Wiradjuri woman from Mudgee. I was always interested in health-related fields. I didn't really have medicine as the top one for me because lots of different reasons actually. I didn't think that there was an entry program or wasn't aware of an entry program being available for someone like myself just from a humble rural town. Whilst I tried really hard at school, I probably didn't think that I'd have the marks for something like medicine. But I was fortunate enough to engage with the right people at the right time, I think. And as a 17-year-old, I went to a careers market in Dubbo and met these remarkable women who inspired me to take that, challenging journey of applying for medicine. And then basically year after year, I kept passing and kept going on to the next year and really enjoying it, embracing it, and just really leveraging off lots of mentors that I had in my life at the time. So another one of those would be Nairi Brown, so a big shout out to her. So it really basically inspired me to walk in her footsteps, really, being one of the first female Aboriginal and Torres Strait Islander doctors in the country. Yeah, as a 17-year-old, I had lots of positive, inspirational women around me who encouraged me to be courageous and to take that step. And perhaps the age thing was another positive strength in that I was maybe not as aware of failure as being an option. So medicine was the starting point in terms of that was the first battlefield in some ways. So making sure that I was, looking after myself and getting through each year was barrier one. The next, of course, is fellowship training and trying to do whatever specialty area that you choose. So for me, I guess, again, coming back to not having a lot of exposure to other doctors growing up and only knowing what a general practitioner did in a rural area, that was what my brief was for myself, I guess, and what I was focused on becoming. So what that means for someone like myself who always wanted to go back into rural communities is a lot of upskilling in a lot of different areas, and that comes with a lot of community expectation as well. So one example is I used to not particularly like obstetrics in medical school, for example, but throughout my general practice journey, it became quite obvious to me as a female doctor that it was an expectation that I would understand and know a lot about women's health, for example, and delivering babies. So that was a skill set that I chased and I'm so passionate about now. And I guess I'm really grateful for just relying also on community to guide what areas and avenues that I had wanted to pursue in later down my career path. One of the upcoming deliveries that I'm really looking forward to is a community member in Charleville. So I'm working out there at the moment, and yeah, there's a real buzz at the moment because we have a book cesarean for next week. So that's one of the reasons that that I went into this specialty area, not only to utilise my skill set in looking after the women, but also to do surgical skills as well. So being able to maximise on the ability to perform caesarean sections in rural and remote areas and other higher end deliveries as well where they're really needed. So going through schooling and also the starting points of my university degree, including into fellowship training, it was often quite a lacking experience in terms of the cultural awareness that was around and cultural safety training that was around for practitioners to be able to understand our points of view as Aboriginal and Torres Strait Islander people. That's been another trailblazing effort that myself and a lot of the other Aboriginal and Torres Strait Islander doctors that I have come through my training with has been foremost in our approaches to trying to bring alongside and bring some allyship with our colleagues to be able for them to recognise that we do have a place and we do have a different point of view, and that we need to treat our patients in a culturally safe and appropriate manner. And that is slightly different than the way that Western systems have been treating the patients for a period of time. But this is good care for everybody. This is a way of engaging with and being safe in terms of engagement with our patients overall. What I've seen moving forward in this space is that the colleges, so Royal Australian College of General Practitioners, the Australian College of Rural and Remote Medicine, are now coming on board with cultural safety training and making sure that all of the registrars and all of the trainees that are coming through the programs are, understanding what our mob needs from a holistic point of view so that they can provide the best healthcare possible to get better health outcomes for our people, which is essentially what we're all after. So another really important agency and organisation that I've been involved in over the years is the Australian Indigenous Doctors Association. So they've been pivotal to some of my successes as well, and certainly need a bit of applause in that regard from myself and also my other colleagues. So we often attribute a lot of our successes to the support in which we've had from AIDA over the years. They've been able to be a really powerful voice when we haven't had our own, and be able to bring us all together to get that one voice, and to be able to have these collective conversations about what is holistic healthcare and what is culturally safe healthcare, and how do we bring everybody together on that journey with us. And all of those things take strategy and leadership and humbleness and the right people at the right table at the right time. And I guess that's what I'm trying to achieve from my point of view, and the 18 years that I've spent in medicine already, and the challenges that I've had and the challenges that are come in the future. They're all just developing me as a person to be able to tackle anything essentially. And I guess I've got my ancestors and my elders to thank for that.